Gally Kaczynski working the AT&T phone and also the editor's desk here in the award-winning KDK Radio newsroom. Dr. Rosales, Dr. Swami, we're all talking tonight vascular disease with your host, Dr. Gerald Pfeiffer. The Allegheny Health Network, a Highmark healthcare company, presents Medical Frontiers. Tell us about it.
Yes, primarily we would be talking about peripheral vascular disease, primarily in the legs. These issues happen in the upper extremities, but most commonly in the legs. And we have a vascular surgeon and a cardiologist are going to be talking about that disease process, diagnosis, and treatment.
All right, what causes it? And I'm going to ask you about nutrition, but what actually causes this? Is it hereditary, Doc?
Well, there's definitely a genetic component to the disease, but generally cholesterol or calcium deposits build up in the blood vessels throughout the body. Our focus today is about peripheral arterial disease, mostly is in the lower extremities, but primarily cholesterol plaques and calcium deposits.
Surgery in most cases is what needs to be done. So what are some of the surgical procedures being performed?
Well, actually, both Dr. Rosales and I specialize in multiple treatments for the condition. It's actually moved away from exclusively a surgical field where oftentimes we can treat this condition with balloons and stents. Both of us are very involved with that. If, however, that's not an option for patients, surgical treatment, generally bypass surgery, is still a mainstay for helping patients.
So, Doc, you're getting regular checkups, and they say, look, there's some issues developing. Can nutrition actually slow it down, stop it, or even maybe prevent surgery if you catch it early?
Well, nutrition can definitely help, but it's I would call them more lifestyle modifications because nutrition is only part of the modification. Most of the folks that we see have smoking as a problem, and without the ability to quit smoking is very difficult to defeat this disease. But nutrition definitely plays a role from that perspective.
I think this guy was actually slamming smoking before the Surgeon General, ladies and gentlemen. Dr. Pfeiffer, have much respect there. So explain to the audience why smoking is just so darn bad for everything.
Well, we know that the products in a cigarette or a pipe or a cigar causes an effect on the blood vessels. It actually can cause them to constrict, to narrow down. And you can also get deposits in the blood vessels because of the smoking. So the best thing to do is to never start. And certainly people who smoke and continue to smoke and they have vascular disease, I know these gentlemen will do anything that they can to get them to quit smoking so that their treatments will be more successful. There are people, there's a disease called Berger's disease, which is just a progressive vascular problem in the lower extremities, especially in smokers. And I've seen people smoking in the hospital while their legs are being amputated. And I'm not in surgery, but at the time, but immediately afterward, when you could smoke in a hospital, I've had patients, you do an amputation, you go see them after surgery, and they're still smoking.
412 doctors. Remember, same day appointments. You call in the morning, they see you in the evening, and more importantly, call us tonight with all of your questions. We're going on the air in just a couple of minutes after CBS Radio News at 7 o'clock and the afternoon news with Robert Mangino, 866-391-1020, and you can always reach us at the Dollar Bank Instant Access Box. You can find that at kdk.com. Medical Frontiers next on News Radio 1020 KDK. Good evening.